So the next topic is Rinne's test. So what is Rinne's test? So to understand the Rinne's test, first we have to discuss the Beaver test. So basically this is your face. Okay, these are the ear. So if you put the vibrating tuning fork on the vertex, you will hear equally vibration on the both side. Let's talk about this is the right ear, this is the left ear, this is the right ear. So if there is a deafness on the conductive side, if there is a conductive deafness on the left side, so what is conductive deafness? So let's assume you have normal ears and you have deliberately created the conductive deafness by closing the tragus. So if there is a conductive deafness on the left side, so you will find the vibrating tuning fork lateralized on the left side. So in case of conductive deafness, if you close the triggers, you will find that you are saying something and you close the triggers. So you will hear more on the side which you have closed the ear. It means on the conductive deafness, in case of conductive deafness, you are deliberately creating the conductive deafness. And in a patient of conductive deafness, the vibrating tuniform lateralized on the side which has the conductive deafness. So in the Weaver test, lateralized to the one side that has one side conductive deafness. And so in case of if there is a conductive deafness of left side, so the vibrating tuning fork lateralized to the left side. Okay, in case of let's assume there is a conductive deafness on the right side, so the tuning fork will be lateralized on the right side. Okay, now let's assume there is a sensory neural deafness on the left side, so tuning fork will lateralize to the opposite side. Okay, so in case of sensory neural hearing loss, it lateralized to the opposite side. In case of conductive deafness, it lateralized to the left side. So let's assume in a question, if you they give you that key Weaver test, the vibration lateralized to the left sides. So it could be left side conductive deafness or right side sensory neural deafness. So interpretation of left side vibration lateralization has two meaning. Okay. Now, uh, what is Rinne's test? So in case of Rinne's test, air conduction, let's assume you have a vibrating tuning fork, you have put on the mastoid, then you put in front of the ear. So you will find that air conduction is better than bone conduction. Always air conduction, you will after the vibration dampen on the mastoid you have put in front of the ear, you will still hear the vibration. So it means air conduction is better than bone conduction. It is normal in case of normal patient. Okay. In case of sensory neural hearing loss, you will finding will be the same. So this is Rinne's positive. So in case of Rinne's positive, in case of normal and in case of sensory neural hearing loss, air conduction is better than the bone conduction. Now, in case of Rinne's negative, in case of conductive hearing loss, so if let's assume there is a conductive hearing loss, let's assume there is a obstruction in external auditory canal. So you will find if you put the vibrating tuning fork on the mastoid, and after that you will put the vibrating tuning fork in front of the ear, you will not hear the vibration. It means mastoid we are testing the bone conduction, because uh, from the mastoid it goes to the uh, tympanic bone and it goes directly to the inner ear, so it tests the bone conduction. Okay, and air conduction testing the conductive deafness. So the second way by which sound can go is from the outer ear to the external auditory canal, then into the middle ear, then into the inner ear. So this is air conduction. So air conduction test is air conduction test the conductive deafness, because sound travel through the air from the, like normally I am saying something, so the sound is going from the external ear, from the air to the outer ear, then external ear, then middle ear, then the inner ear. So this is the normal conduction pathway of sound. So if there is obstruction in between this pathway, so that is known as conductive deafness. So air conduction test is the conductive deafness, and bone conduction test is the sensory neural hearing loss, because we have put the vibrating tuning fork on the mastoid. So if you put the vibrating tuning fork on the mastoid, so what you will find? You will find that from the mastoid it goes to the tympanic bone, then it goes to the directly to the inner ear. So bone conduction test is the sensory neural hearing loss. So in case of normally air conduction is better than bone conduction, so it is in case of normal ear and in case of sensory neural hearing loss. Okay. In case of Rinne's negative, that is bone conduction is better than air conduction in case of conductive hearing loss. Okay. So do you understand the concept why bone conduction is better than air conduction in conductive hearing loss? Because why bone conduction is better in conductive hearing loss? Because in conductive hearing loss, there is obstruction in the pathway. So air conduction cannot go. So that's why it is bone conduction is better than air conduction. In case of Rinne is positive or in normal person, air conduction is better because air pathway is intact. So air pathway is intact, so air sound can uh, directly go to the inner ear. Okay, and in normal person also. So in case of sensory neural hearing loss, in case of normal person, air conduction is better than bone conduction. Now let's talk about a patient who has severe sensory neural hearing loss. So in case of severe sensory hearing loss, bone conduction is better than the air conduction. Why? Because due to conductive deafness, sound will not able to get obstructed by anything in the pathway. Okay, or it can stimulate the opposite cochlea. So that's why in case of severe sensory neural hearing loss, bone conduction is better than air conduction. To solve this though, to solve the MCQs of Rinne's and Beaver test, they will not ask you directly the test, they will ask you the MCQs. So first you have to see the whether waiver test is left side or right side. So if the waiver is lateralizing left or right, so you have to first make a diagnosis. If waiver is lateralizing to the left, so make a diagnosis. It could be left side conductive deafness or right side sensory neural deafness. Okay, so you will there are four options, so two option will be eliminated by this. After that, then go for the Rinne's test. So if Rinne's test is positive on the right side, so it is sensory neural deafness on the right side, and it is also suggesting Weaver's test also suggesting that it could be right side sensory neural hearing loss. So first to solve these MCQ, you have to first see the where is Weaver test, and then you can then see the Rinne's test. So by if both are suggesting one thing, then it is the answer. So these MCQs are very simple if you apply a basic logic. Okay.